It's important to make some changes in mental health care because we have a system that is broken for many people.
Individuals experiencing mental health problems sometimes they're just underserved and they don't get enough kind of love, attention, press as maybe some other areas do.
Health Fairview is actually the largest provider for mental health and addiction care in the upper 5-state region. The exciting part is that we have actually advanced in a good portion of our primary care clinics an integrated primary care model.
Right now, the majority of our patients come in through emergency departments, and those environments tend to be really busy and chaotic just by nature, and therefore just are not a very calm, healing space for those patients, particularly if they're coming in, for the first time. They're scared, vulnerable, here to seek help.
So it's super exciting that we're actually opening one of the first EmPATH units in the state of Minnesota and in the Twin Cities, where we actually have a completely different model.
Moving a patient to an EmPATH unit will allow them to get help from licensed mental health care providers as well as psychiatrists.
Purposely a large open space, this large milieu space that's shared by all of the patients. There's a lot of attention paid to the proper light and sound just to really make it feel calm and healing. There's a high level of engagement with the treatment team. It's multidisciplinary. We'll have psychiatrists, mental health nurses, other licensed mental health professionals, and patients will really be able to engage with each other and with their treatment team in this milieu environment. It'll be just highly interactive.
Research has actually shown that when you can treat a psychiatric crisis emergency in an EmPATH versus more of a medical model emergency room, that there's a 30% less chance that you actually would even need acute care or inpatient hospitalization. So specifically on the St. Joe's campus, we have a clinic that isn't maxed out in terms of capacity. So we are creating access for same-day appointments for our community and our patients who have a mental health and addiction urgent need, working very closely with some of our referring physicians, primary care, some of our healthcare partners in the community.
Our commitment to mental health, it's standing strong. We will continue to be the largest provider of mental health care services.
I'm extremely hopeful about the future of our mental health and addiction service line. We are just being innovative. I think we're just breaking down all the norms, what we thought mental health care should look like, and we're evolving and adapting to meet the needs of our patients and our communities. And it's so exciting to be a part of it.
Our goal really is to meet our patients and families where they're at, serving our community for wholeness. So whether it's a medical need or a mental health and addiction type of a need, it's treating the whole person, where they're at, where they present, to bring wellness.